Hi guys, my name is Alina Starabinski and today I'm going to be talking about iron deficiency anemia. Today is August 25th, 2019. Anemia is defined as a decrease in number of the red blood cells or amount of hemoglobin in the blood. Without enough of iron, the red blood cells can't carry enough oxygen to our body tissues. Without enough iron, your body can't produce enough of substance in the red blood cells that enables them to carry oxygen, hemoglobin. Classification of the disease. Anemia can be classified based on the size of the red blood cells and amount of hemoglobin in each cell. So if the cells are small, they call it a microcytic anemia. And if the cells are large, they call it macrocytic anemia. And if the cells are normal size, they call it normocytic anemia. Etiology. So what happens? How do we get iron deficiency anemia? So it's most of the time it's lack of iron in our diet. So our body regularly gets iron from the food that we eat. Some patients have a hard time absorbing iron, and when we absorb iron, it usually happens through the bloodstream, and it usually happens in the small intestines. Some patients may experience some blood loss, and that's how they get iron deficiency anemia. They could have some problems like ulcer, peptic ulcer, or hiatal hernia, or they might have colon polyps, or colorectal cancer can also cause iron deficiency anemia. So the syndromes occurring in males characterized by severe iron deficiency anemia are hypogonadism, dwarfism, hepatosplenomegaly. Geophagia has also been observed in villages in Iran suffering from malnutrition. So malnutrition is a big deal. And it's very important to make sure that you eat enough of food that contains iron in it. Corrections of anemia can be resulted in marked decrease in size of the liver and spleen. The symptoms and signs. Most of the time, people feel extreme fatigue, weakness, pale of the skin, chest pain, fast heartbeat, shortness of breath, headaches, dizziness, lightheadedness, cold hands and feet. That's a very popular one. A lot of my patients, when they come, they say, I'm always cold. And I'm always sleeping in socks, and I'm always wearing gloves, and I always have hand warmers. And also, a lot of times patients have brittle nails too. That's another sign of iron deficiency anemia. Most important test that doctors prescribe is complete the blood count of CBCs. Additional tests may be ordered to evaluate levels of serum ferritin. Ferritin is actually a protein that contains iron in our blood cells. And total iron binding capacity and transferrin. So those are the tests that are most important. Differential diagnosis. Iron deficiency anemia is classified and described as a microcytic anemia. The differential diagnosis include salathemia, sideroblastic anemia, some types of anemia, chronic disease, and lead to poisoning. Serum ferritin is the preferred initial diagnostic test. That's the most important one. Complications. Complications could include depression, heart problem, increased risk of infection, motor cognitive development, delays in children, especially in pregnant women, pregnancy complications such as preterm delivery or giving birth to a baby with a low birth weight. And preventions. How can you prevent iron deficiency anemia? To prevent iron deficiency anemia, you can choosing by a proper diet, choosing rich iron foods, include eat a lot of red meat, pork and poultry, seafood, beans. For vegetarians, they could add dark green leafy vegetables such as spinach, dry fruit, such as raisin, apricots, iron fortified cereal, breads and pastas and peas. I also want to mention that you can also take supplements. Doctors usually prescribe some supplements. You can take iron pill once a day, every day, and that would definitely help out. But a lot of women don't want to take iron pills because it makes them constipated, and but there's also there's a liquids irons that you can drink, and there's also, I believe, there's a shots that you can do, like an iron shot, and it's good for a year. So there's different things that you can do, but I think the most popular one is when women go to a gynecologist. The doctor prescribes, depends on her levels of her blood, what level is she's at and how low of anemic she is. He prescribes, usually it's a daily iron, it's called sulfate, a little pill that a woman take. So that's what usually doctors prescribe. It depends also on the level. So if it's not, if it's not severe, it could be iron pills. If it's something else, a doctor would take other precautions. So I'm gonna put all my sources that I used right here on the last page, and I hope you guys enjoyed this. I hope you guys learned a lot, and I did this real fast, so let me know what you think. Thank you so much. Have a good day.